Hello, I'm Dr. John Shuck, Chair of the Joy of Medicine Advisory Committee for the Sierra Sacramento Valley Medical Society, or SSVMS. SSVMS is dedicated to bringing together physicians from all modes of practice to promote the art and science of quality medical care and the physical and mental health of our entire community. Serving Sacramento, El Dorado, and Yolo counties, we have more than 6,500 members and run our own 501c3. We are also a component society of the California Medical Association. So what is Joy of Medicine? As we know, physician burnout rates are dangerously high. Healthcare workers are under immense stress, are drastically understaffed, and are continuously overworked. As we know, physician burnout rates are dangerously high. Healthcare workers are under immense stress, are drastically understaffed, and are continuously overworked, all of which was highly exacerbated during the COVID-19 pandemic. Joy of Medicine aims to relieve physician pain and help them reclaim the joy of practicing medicine through education, advocacy, and services designed to nurture individual well-being and system-wide changes. It's a multilateral approach to physician well-being that encourages resilience, connections with colleagues, and collaboration with leaders to foster a culture of wellness. Currently, program services are available to all physicians regardless of whether or not they're an SSVMS member. Since its launch in 2017, hundreds have accessed these services. Okay, that's a lot to take in, right? But what does it actually do? First and foremost, we sponsor confidential counseling sessions with licensed psychologists and life coaches. To date, the Joy of Medicine program has supported nearly 300 physicians and sponsored more than 1,100 sessions with a provider. Whether they are seeking support with work-life integration, relationship issues, burnout, grief, or trauma, our providers are there to offer counseling and to support these professionals and their unique needs at no cost to the physician. We also offer private peer support groups. Facilitated by a provider and hosted at the home of a physician wellness leader, small groups meet monthly and give physicians a safe space to socialize with colleagues experiencing similar challenges and successes. In addition, SSVMS offers balance groups. These groups focus specifically on the clinician-patient relationship. During the facilitated discussion, group members gain new insights about the patient's and clinicians' perspectives and their experiences with each other. The Joy of Medicine website hosts a robust online wellness resource library, everything from suggested reading, podcasts, videos, research materials, websites, and more. In addition, we run our own podcast, Joy of Medicine on Call. Hosted by a wellness leader, the podcast explores various topics related to joy through interviews with specialists in the field, physician leaders, medical students, and those on the front lines of the COVID-19 pandemic. The annual Joy of Medicine Summit is just one of many social events sponsored by SSVMS. There, physicians hear from wellness leaders about best practices, are provided resources, and get the chance to relax with their colleagues. But it's not just the annual summit. SSVMS hosts several events each year, from paint and sip parties to walking challenges to holiday and family socials. We are always looking for a way to get physicians together again. SSVMS also convenes the Joy of Medicine Advisory Committee, which includes the Chief Wellness Officer or equivalent from each of the Sacramento region's integrated medical groups, as well as physicians in private practice, medical students, and residency program representatives, to collaboratively shape the goals and activities of the program to benefit all physicians and physicians in training. The committee meets on a quarterly basis to share best practices, provide guidance on program offerings, and to advise SSVMS on the direction and sustainability of the program. Participating physician organizations, including the Permanente Medical Group, Sutter Medical Group, UC Davis Health, Mercy Medical Group, Woodland Clinic Medical Group, Sutter Independent Physicians, and Hill Physicians Medical Group, contribute to the sustainability of the program through charitable contributions. So where are we headed? SSVMS is continually improving and adapting the program, especially in these challenging times. We pivoted to virtual when needed, but we are looking forward to bringing physicians back together in person for the annual Joy of Medicine Wellness Summit. This program is one of the best in California, focusing on the needs of physicians, and we are thankful to our partners and providers for their hard work and dedication to supporting our healthcare workforce. Thank you.